Is your shoulder pain a neck problem? Shoulder and neck pain are closely related because they're obviously really close to where they are on your body. Sometimes we'll see patients come in with a shoulder pain or a pain that runs down their arm that's actually coming from the cervical spine origin, so your neck. And that's because out of your cervical spine, you actually have a thing called the brachial plexus, which runs 3 big nerves out of the neck and then down the arm. And that commonly can refer pain to the tip of the shoulder, down to the elbow, or even down to the hand. So sometimes shoulder pain can be actually missed as a neck pain problem. With the neck as well, we have facet joints which make up the joints of the spine, and they can also refer pain down the arm. So if you have an irritated facet joint, that can also refer pain down into the shoulder or down into the arm. When we see a patient with shoulder pain, we want to make sure that it's not coming from the neck. So typically in that scenario, we would do some orthopedic testing around the cervical spine and some other testing to make sure that the pain that they're feeling in their shoulder is not coming from their neck. So when a patient comes in with shoulder pain, we want to assess and make sure that that is not coming from the cervical spine origin. So we will do some orthopedic testing to make sure that the cervical spine is clear. If that's inconclusive, or we think there's a need to refer out for an X-ray or any other further imaging, we'll do that. Once we've established that it is coming from the shoulder, we can then use a range of different treatment modalities, such as needling, soft tissue work, some mobilizations, kinesiotaping, and some manual adjusting around that area to help with that shoulder pain. And if it is coming from the cervical spine, we will do a different technique where we will do some manual adjusting or activator adjusting around the cervical spine, again to restore the biomechanics of the joints. If it's coming from anywhere else, such as muscle pain, we might do some dry needling in and around the cervical spine or up in the upper traps. And also we will do some kinesiotaping and give the patient some exercises or rehab, a bit of a rehab plan to do at home when they're not in the clinic. So the reason it's actually important to make sure that it's not coming from the neck and that it is actually shoulder pain. An example we would see is, for example, a rugby or rugby league player where they're tackling. They might irritate up through the neck, and that will pull on the brachial plexus, which are the nerves that exit from the neck, and that patient would have what they call a stinger, where their arm gets really sore, it's potentially numb. So they might come in then on the Monday after the game and they'd be like, oh, my shoulder is really, really sore. So we want to make sure that it's actually coming from the shoulder and it's not coming from the neck or any of the tissues surrounding the neck that could cause that pain, such as the discs, such as the facet joints, or any of the other neural tissue around that area.